Arabic or somebody, speak English, but if, I will mix it up here. I rarely give talks in the Middle East. I've been privileged to give talks all over the world. I was telling Muhammad I'll be privileged and honored to give a talk in the Japanese Society of Neuroendovascular Surgery as one of the keynote speaker in Japan, but I've done it before. So, I haven't had any big meeting in the world that related to neurointerventional that I has not have not been invited to. And I come from a very, very small background, right? So if I can make it, I tell everyone else, I tell my own kids, if I can make it, you can make it. If I can make it, you can make it. I come from very humble background. My mom is and dad were farmers, then truck driver, and not educated. So like most of the Jordanian, and most of the Middle East, we're probably the first, and some of you maybe second gen. You're young, so you're already like my kids' age. So you're probably the second generation. But we come from a different background. You have made it so far. You have the technology, and I think I'm very, very, very optimistic person, and that's key to success. How to build a career, maybe one thing, maybe we can talk about it as a seminar, and you can ask question, or I can give you some slide. I'll try to go through the slides quickly to allow you opportunity to ask question, and so a lot of it is about you and your own inspiration. Many things we do in life is self-ignited and self-motivated. Many things, believe it or not. It's good to have some roadmap, some guidance that helps you along the way, but a lot of it has to come from within. Nobody will take you to go to the library to work. Nobody will take you away from your friend fun time and a coffee time and go to write a paper. That has to be your own, and it's only you can make it, and no one else can make it. There's a lot of dead time, I call it dead time in my career, that helped me get where I was, where I am today. One thing is lots of the cold night when you are a resident, you must be tired. But if you go to the room, you sleep. But if you go to the cafeteria and open a laptop, you may be able to work on a paper and write something. So there's a lot of what I call it dead time in our life. Try not to make that dead time, I think time, over and over. Time is a brain, since we're talking about neurology, but time is career. Time is a brain and time is career. So so you have to have a balance. I like to spend time with friends. I like to spend time with family. I like to have my cup of coffee. I have to stop by Tim Horton this morning. It took me about 20 minutes to get a cup of coffee.
It's worth it, I think.
It's worth it, absolutely. So with that being said, I am currently the neuroscience and stroke medical director in Toledo, Ohio. That's where I am now, right now. I run the neurology residency program. I wear a lot of hats. I may have four jobs together, but I enjoy them. So I'm the neurology residency program director. I started this program about 7 years ago. So right now we graduate five neurology resident a year, five. And you have an opportunity to connect, through Muhammad today with me and other like me. I also run the endovascular interventional neurology program, the longest lasting interventional neurology program in the USA. I was like one of the cowboy. How this neurologist dare to train other neurologists. I know some people are aspired to be a neurosurgeon here. I think nothing wrong with that. Absolutely, you are welcome here. I'm very friendly to everyone, whether you are neurosurgeon, neuroradiologist, or neurologist. I take a pride of building bridges among neurosurgeon who are endovascular, neurologists who are endovascular, and neuroradiology who are endovascular. You can come to the endovascular or interventional neurology from different background. My name is all over the internet. My email is all over the internet. I'm on LinkedIn, very active in many positions. So you can always reach me for career advice. I'm very brief, but not rude. Lots of this medical student want to hang around and shadow me. They have managed to. Less likely, I'm going to write you a full paragraph. But I say, just when you're ready, let me know. Probably that's what I'm going to tell you. I'm not trying to be abrupt. I'm not trying to be rude. I'm trying to just move with my day and continue to carry many, many tasks and many hats. So that's what I do. And there's different journey as a leadership. Sometimes in medicine, it's important to really carry your vision to be in the leadership position. If you don't have a seat at the table, you don't have an opinion. So how can we help others? We can help others by having a leadership position. So we want all of you to have one day a leadership position to help others. And I want to see the new generation be the leaders that I was and better than me. That's always what you want to see the next leader. So that's a little bit about where I am today. Okay, so now let's dig deep, a little bit deep about these are my disclosure. I held a lot of position. Everyone who had that position today, I've had it before. I hate to say it. So, I founded the Society of Vascular and Interventional Neurology, and I was the first president 16 years ago. And we founded it from my office. Nobody believed in it. And I had one of the famous interventional neurologists at Barrow Institute. He said, if somebody think of SVI unlike Apple, that society that started in a little office in Milwaukee, Wisconsin, became very big. How did we start it? How did we build that career around leadership? If you want to involve nationally, you have to believe in the vision, and you have to be persistent and believe in the vision. I kind of, very, very, very lucky in my career. I've done research, I've done leadership and administration, and I'm also recently embarking on the most exciting things that I wish I did it earlier, which is a startup company and making a medical device is now my passion. You can see us on Twitter. You can see us on LinkedIn, Galaxy Therapeutic. Follow us on Twitter. Follow us on LinkedIn. We have this nice brain aneurysm device. We are very proud of it. We treated 200 and almost 90 patients in the United States with it. We are in the middle of the trial. The trial will be done next summer. We enrolled a lot of patients. The Jordanian physician helped me to achieve this vision. Many of the Jordanian physicians helped us, and they call themselves Nashama. So people here, so the Nashama for Galaxy, they call themselves Nashama for Galaxy. It's unheard of to do a startup company without going to what we call VC, venture capitalists. Some people savvy with business on this call know what VC is. Believe it or not, we managed to take Galaxy to the FDA clinical trial. And that's because of people like you, people who believed in us, people who helped. So it's very critical to build a career to help each other. Collaboration is critical, critical. I just put this slide, which is boring and nauseating to me to look at, to show you that you can be there one day and how to build it in many facets. And, I don't know how this happened to me, but it did happen. I don't know how to help you to really do it, but this is from the American Academy of Neurology, how to help. I'm sorry, what happened here? Let's share again.
Uh,
Somebody block me from sharing.
no.
Already, let's try again. I think we are at this slide. Okay, we'll share again. Okay, so do you guys see the slide here again?
Yes.
Yeah,
Yeah, yeah.
perfect, thank you. So you can see that I don't know how many of you are resident. In the beginning, when Muhammad asked me to talk about this, I was thinking to start with a survey to know from those 70 people that are gonna join, how many medical students, how many early career people, how many fellows, how many which country they are based off. It would be cool to do an online. Maybe Muhammad can survey the group or give us some statistical data on what level of your career you are in. But first, you are all, or the majority, like the people who approach me from overseas, trying to get into the residency in the United States. So the first thing in your career, to get the medical student you are right now, and be good at what you are. And I keep telling people one advice: focus on the step you are in. If you don't focus on the step you are in, you'll fail miserably. You may not have a career. So what I mean, like, some resident comes to me, Dr. Zaidat, I want to write a systematic review. I want to write a paper. Well, I get a complaint about you. You're not doing the job when you're on call. So now you may not even finish the residency because you want to become a researcher ahead, right? You want to put the right. You don't want to put things before something. You want to be the best resident. You want to be the chief resident. You want to be the best clinician in the 4 years. If you have time, you have to do it on your own. But I don't want to hear your in-service exam. In America, we call it in-service exam. you are doing miserably with your in-service exam in internal medicine or neurosurgery or neurology, which is an annual national exam, to see how your knowledge is, and you're scoring 5 percentile, and now you want to publish a systematic review or a paper in the New England. Now you're doing the steps in the wrong fashion. You want to be a solid. I remember when I was a neurology resident, I always felt weak. I needed to finish one textbook because we come from Jordan, where we have to read a book, which is kind of not necessarily the best way. But I had to finish a neurology textbook. So I picked the smallest book to finish it from cover to cover. And that's really critical for you. So even if you finish a little black book of neurology, the little black book of neurology, you can finish it from cover to cover. It's a pocket book of neurology before you start writing a paper. That's important. If you have time, you can write a paper. So clinical circle is very critical for you. You all want to do residency, either neurosurgery, neurology, stroke, fellowship, neuro ICU, or neuro hospitals. And this is important because you were thinking you want to be the next biggest interventional neurologist, neurointensivist, or whatever you want to be. But when you focus on neurology, you may discover you want to be the next Parkinson's disease expert. You may discover you want to be the next skull-based surgeon in the world, like Osama Al-Mifti or something. Osama Al-Mifti, a Syrian famous neurosurgeon, or Yasser Girl, or other, to bring names into the field that you like to. I don't know what you like to be at. So the first step into building your career is finding a residency. How to find a residency? I think connection, right? Connection is critical. If you have a paper in medical neurology is good, but I will tell you, in United States, if you are talking about United States, I get 550 applicants. 550 applicants for neurology. I only have five for 550. It's beyond human ability to look at your achievement. What do we look first? Your scores. Scores is the first weeding mechanism. So that's why in medical school, your focus is the board exam. In neurology residency, your focus is the in-service and to become the physician, the well-rounded physician, the professionalism. I call it, like, I don't want to hear about, personality. Emotional intelligence coming from the Middle East is something we need to focus on. Friendly, hard work, that we call it the triple A. The triple A is affable, right? Affable. Anyone knows what is the second A? Available. So you want to be affable, friendly, and available, right? And able. So you want to be, available. When they page you, the resident need to be available when they get paged, and they need to be friendly, not abrupt, not rude with the nurses, with the consulting physician, and need to have to provide meaningful consult or able. So triple A is key for your success. Available, affable, and available, affable, and able. Perfect. So that's when you go to the neurology residency. And the medical, I should have put in the medical school before the first circle. Where you want to get into a career, you need to go to medical school. And the medical school, you need to go to, honestly, you need good scores. And then the rest comes. Don't focus on 10 paper when you score 220 or 210 or 205, or you have a failed attempt. It gets us all in trouble to help you. I'll be honest with you. So your focus should be in each stage of the block of the career to be solid foundation first. Then you move to the research part. In the beginning, I struggled with my research skills. Then I decided, I was at Case Western in Cleveland, and I decided I didn't know what the heck is odds ratio is. I didn't know what the heck is, risk, relative risk. I didn't know what all that concept. So I decided to do, and I was lucky when I was faculty at Case Western as a neurointensivist, the tuition for free gets waived. So I said, I'll be a faculty, and on the side, I'll do a master in clinical research. So I did a master in clinical research to equip me with. Some people say you don't need it. You can read it and do it online nowadays. Yes, we didn't have the internet in 1993, 94. Now you probably could train yourself. I agree. But I did the master, which helped me with the methodology and the writing and the training and stuff like that. So that becomes really critical. Then you want to decide. You want to become the researcher pioneer, a career in research, a career in education, and even in United States, when they promote you, They promote you as education pathway and research pathway, or you could be administrative pathway. There are two pathways in America for each faculty. Not every faculty under the pressure to publish, because not everybody, some people hate write a case report. What can you force them? But they are the best educator. I mean, I'm jealous and envy, and I watch others. You're going to watch others. You have to watch others. You can learn from your teacher, the bedside manner, the way he speaks, the way he talks. You know, I wasn't really a good speaker from day one. I was like hesitant, blah, 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 all that things, So, and my slides were busy and ugly, all that stuff. That comes with time. And some people are good educator at bedside. So, I think one of my favorite neurologists, Ted Westerbrook from Case Western, he didn't publish a paper in his life. He's an MS guy. He never published a paper in his life. But we all gravitated to go rounding with him, not with the most famous guy in the department with publication, but with Ted, because Ted Westerbrook was the guy who would carry, the tuning fork, the hammer. The rest of the faculty may not. So you really wanted to become a good educator. You can be a chem educator, and in the United States, you can be a full professor based on education pathway only. You don't have to publish a paper in your life, but you can be the best education. Like transmit the information is not an easy thing. I could teach you cranial nerves, and you never get anything out of it. And you get another guy who doesn't publish a paper in his life, and he said, like, this is my favorite teacher, right? At the Jordan University, the guy that carries all the, back then, Dr. Bostami used to carry all the colored chalks and teach us neuroanatomy. He's an amazing teacher. Everybody, like for generation, talked about his ability to give you the best education in neuroanatomy. So these things are critical, to become an educator. So you pick a pathway and stick to it and enhance. There's now online, like in our department, there's lecture about faculty development, how to become a good educator. So we are by the ACGME required to give our teaching faculty development seminar. So there is also pathway. Then leadership. I think leadership, as physician, we hate it because we want to take care of patients, but it's critical pathway. Like I can tell when I mentor people in my department, I can tell, don't bother trying to just come with me. You want to become a researcher, but just because it sounds fancy, because it sounds good to be on the podium giving a lecture or doing an abstract or doing a poster, but maybe I see in you that you are going to be the next chief medical officer in the hospital. I see in you the leadership. I see in you the emotional intelligence. You have to discover who you are, what's your calling. That's the slide about. There is multiple pathway. Recently, like I mentioned earlier, I added to the American Academy of Neurology those two lines underneath it, which is a lot of physicians discover, oh my God, I hate being a physician. Then you can go to Eli Lilly, run their weight loss program, and go to a company that working on Alzheimer's disease drug and become the physician, then run the clinical trial from pharma. So you can apply for a job in pharma. There's a lot of job in pharma and medical device company. So you can choose a pathway to help you to get a different career pathway like this. Or you can, if you have ideas in software, if you have ideas in a startup, you can do a startup pathway. The very famous in neurology, does anyone knows Viz AI? Viz AI, it's an AI program. Does anyone know Viz
Yeah.
AI? If you
Yeah.
know Viz AI, can give me a thumb up. Viz AI is an AI company that can look at the CT scan. I know some of you are very early in your career. Yeah, so very early in your career, and the application in imaging for AI is huge. So neurology is ahead of the curve. I know people say neurology, we don't do anything. That's absolutely wrong. And we don't mind it. So keep people away from coming to neurology, less competition. But the truth of the matter is neurology, the most advanced field in virtual health and in AI. Why? Because stroke became very critical. And there is little neurologist out there. So telestroke and virtual health became integral part of stroke since the late 90s. So we've been doing telestroke and virtual stroke before any other field. So because we need to give TPA fast, and we need a neurologist to hop on the camera fast. So we've been doing telestroke for a long time. And then thrombectomy came along. and the neuroradiologists are not many of them. So this AI is an AI detection of large vessel occlusion. Yeah. Okay. So, but who thought of this idea? I know the guy personally. He's actually Egyptian British guy. His name is Chris. Look him up, Chris. So Chris is a friend of mine who started this AI. He's a British neurosurgeon. Muhammad, talk to Omar about him. He's a British neurosurgeon. His wife is a gynecologist. She's a British Egyptian who's a neurosurgeon. He went to Stanford to do an entrepreneurship course. He met the Google guys and told them, I want to be able to detect on the CTA the large vessel occlusion. They help him with money, and he started Viz AI, and he quit neurosurgery. So he quit neurosurgery. So that's a career path. And one of my disclosure, I'm an advisor for them for Viz AI. So Viz AI is a software started AI company by a neurosurgeon who quit. So there's a lot of career in neurology and stroke outside the bedside career. So that's critical for you to choose from.
Doctor, we
Right?
did a narrative review on stroke and we included with AI.
Exactly. So Viz AI is a very nice app. It's on my iPhone. So when we get a patient with a stroke from an outside hospital, that patient with a stroke, we can get the CTA analyzed, we can get a ring, we can get an alert.
Yeah.
There's a large occlusion, get the angio suite ready, get the thrombectomy ready. So it's a very nice app. It's a membership, it's a subscription app. So if you want it in Jordan, we can talk to Chris to see if he can help third world countries and be nice. But we first have to have the interventional lab ready and the stroke program at the whole country, which we are behind ready. So that's another career pathway you can pick. The clinical research, it's very critical to really do a clinical research, and it comes from the love of really trying to be a curious mind. So you have to have a curious mind, and research is to see what everybody else has seen and to think what nobody else has thought was absolutely true. So when you run, regardless where your career take you to neurology, neurosurgery, or you have a change of heart, go to internal medicine and cardiology, you will see people doing the same thing every day. But then you think of something different. But the thing that everybody's seeing is there. But your ability to see within is what makes you different. And this is really a cool exercise. My first course about research is an epidemiology in stroke. And the guy gave us 900 patient data that he had access to. Data is clean. He has researcher put the data and said, each one of you, the 20 stroke fellows, when I was a stroke fellow at Case, should give me an abstract out of that data, and we will rank it. Which one can see different things within the data? So we all given exposure to the same data, but the rank of the best winning abstract, it depends what can you see within. So again, really very cool code. Resonate a lot with me. Resonate a lot with me. The ability to see within data, within practice, something different, make you unique. And that's the struggle. 99% of entrepreneurship, startup, any job we do, clinical care, how can we change it? The guy who decided you know, instead of the echo, we're gonna have the butterfly ultrasound, right? You know, all those ideas that you say we all use a stethoscope. Now nobody uses stethoscope. So all that kind of idea and the thing that you see that you could make a difference in, right? My friend right now think we should have an AI and robotic ultrasound for PIC line. He's working on a company to do a PIC line on the floor with robotic AI than a human. So the PIC line is there, but you would say, oh, there's nothing really else I can do with PIC line. Why would I think PIC line needs an innovation? So the ability to see within is really met distinguish people and career path. So the clinical research is to me, at least the way I feel it, that I like anecdote myself. I like gut feeling myself, but I also have this inner feeling. My other gut feeling is my gut feeling is wrong. So you go to the doctors, they are full of confidence, and they say, well, your knee replacement, is really best with this device from Stryker or from this, from that. But then you really don't know for sure that the ultimate solution for the knee, maybe a new material would be better. So that gut feeling and anecdote can take you to a direction, to a certain level. But beyond that level, you really need to question everything you do on a daily basis. You have to question everything we do. I mean, we have to practice at a given cross-sectional time. But however, when you go to the next level, you really need to question the way you practice, and it's a dynamic. I have example in my career. When I was doing a thrombectomy to remove a clot from the brain, I never believed in balloon guide catheter. I never really believed in balloon guide catheter. But we did a study, and in the study, I was on the side of balloon guide catheter is waste of money and time. In my opinion, my gut feeling and my anecdote that when I use the balloon guide catheter, it makes the procedure longer, it makes it more cumbersome, and it makes it more complex. So I was not using it. But then I said, let me study the balloon guide catheter myself. And we were the first one to show the balloon guide catheter could make a difference. So again, you have to question your practice and be open-minded, open-mindedness, and then find the equipoise. Something, as a new researcher, something is hard to really find an equipoise. Something is very obvious, right? You don't want to study the very, very obvious. In neurology and neurosurgery, it's hard to study mannitol. You guys know mannitol, right? You know mannitol, right? When there's an ICP, you need to give some osmotic therapy to lower the ICP. So not really being, studying to randomize the patient to mannitol or no mannitol is pretty hard, very tough. So again, some of the questions are obvious when you do research. So the very beginning of your question is to discover and interpret the fact that you do on a daily basis. Then you have to revise and accept your theories, and then you have to look at the practical application. My famous my famous my famous friend from Harvard years ago, he came and gave a lecture. He said, the best research is the simplest research, not the sophisticated, because we do things on a daily basis, but sometimes we don't pay attention to the simple one. I'll give you an example in my career, that one of the things that I should put in my license plate, the first pass effect. I don't know if so many people know or hear about the first pass effect in thrombectomy field. First pass effect. So I was very lucky. It's the simplest research, but many people worldwide, when you talk to neurointerventionalists, know Dr. Zaidat from first pass effect. What the heck is first pass effect? Some people call me Mr. First Pass Effect. It's the simplest research. I publish sophisticated research, but the first pass effect is the ability to take the clot out of the brain with one attempt. Like, you're fishing, if you like fishing, and you get a fish from the first attempt. So the problem when you try to clean in the cardiology and neurology, when you try to clean the vessel, you need to go a couple of times. Ladies in the house, they don't like to clean once. They need to clean multiple times. Imagine if there is a robotic vacuum cleaner, go through the house once and the house looks pristine, right? That's first pass effect. So we coined this term, first pass effect. Bless answer sometimes. So keep that in mind. So, you have to define your purpose of the research question, establish the standard of the evidence, real-time data, improve transparency, improves quality of care, improves outcome when you do research. So I like research. I like, personally, I always like intrigued and curious about is what we're doing the best or can be better? Can it beat anecdote? Because we all come from a culture of macho culture where people tell us what to do and it's the right things to do, which is the anecdote. We're not allowed to question. Maybe it's the rebellion in me and should be the rebellion in you. You should question everyone. We were taught not to question everyone. In round at the Jordan University, if you question the professor, you may not pass the course, right? So questioning was not ingrained in our mind. So the minute I had the opportunity and came to do residency in United States in 1993, when I finished Jordan University, I felt like, oh my God, I can question anyone. And the professor will say, check me out, look this up, look this up. So they didn't have the dogma and the convention that whatever they say is the right thing, whatever they do is the right thing. They didn't have that. And I think we are changing. The new generation are much better. Your teacher is much probably better. That's the nature of the evolution and the revolution, So again, again, it's very critical that to say to yourself, anecdote is good and my experience is good, but research is better. So again, lots of flow scores, the idea is to try to generalize on your anecdote with your own population in your own office for expanding the knowledge, expanding to the masses. That's, at least in my opinion, I think so many people with anecdote and gut feeling are great. Okay, so anecdote, what does anecdote mean? Meaning that, excellent question. Anecdote, that it's the definition of it in a fictional space is like, you go and treat a patient. Myself, I treat a patient, I give them for their migraine headache. Let's take migraine headache, right? I give them the black seed with honey and lemon. I mix it, I give it to them, and their migraine headache goes away. So I say to you and my next patient, look, I treated a 3 patient with this mix of drink and they all recover. You didn't do randomized trial. You didn't do anything. Oh, ginger is great. Ginger is great. Turmeric is great, right? All that things. Oh, you need to mix the parsley. I mean, those are the fastest money making things. Put kale, parsley, and everything, and next day you get like super smart or super awake or super energetic or something. So this is your anecdote because you treated 1 patient and worked, right? Or you say, oh, last time I'll give you a not really holistic medicine example. I'll give you a real medicine example. Oh, I used the balloon guide catheter. Balloon guide catheter you put in the blood vessel in the carotid, and I inflated that to stop the flow, and then I took the clot out from the first shot. I did, like, all my cases do good, and we try to inflate our anecdote. We inflate our anecdote. We inflate it because our ego allows us to inflate it, right? Our ego allows us to inflate it. So you go there and then you say the balloon guide catheter is the best thing invented in the world, and you go test it in randomized trial, and that anecdote of your previous experience fails miserably. So anecdote is an experiment, whether it's emotional experiment, whether it's a holistic medicine experiment, whether it's a real experiment, that based on that result of that single encounter, you see your life based on that. We do it in our daily life a lot, right? And then it becomes sometimes a nostalgic effect. We can take it on and on. We can talk about anecdote and nostalgia forever, but yeah, you're right. uh, perfect. So I think we have to avoid the anecdote and try to follow evidence-based medicine. And gut feeling is another common thing with physician. Gut feeling is my gut feeling that if I do this and this, it's better approach for your surgery than through randomized trial. Like, if I give you a good example, my gut feeling, after you give the patient TPA, the blood pressure should be 160 to 180 systolic. That's my gut feeling because it makes sense. My gut feeling that higher pressure will give the brain a little bit more blood to recover. When I do the randomized trial, when I push the pressure to 160 to 180, more people have bleeding than recovered. Then my gut feeling was wrong. I may have had it successful in 1 patient because the patient has other factors. But that's my anecdote, and that's my gut feeling, and that's my evidence base. So those 3 triangle make sense, right? So, so you can build a career in basic research. We have many people, who really did excellent job in basic research. I'm definitely not the guy who tells you how to build a career in basic research, but I have a lot of friends we can connect you with. They run labs at John Hopkins, they run labs at Harvard. So I'm very proud of our community. There's a lot of they call them true scientists. I'm not a true scientist in that sense. I'm not a basic researcher. I'm not gonna discover the molecule, but I want some of you to do it. I want you to be able to be to do basic science. I think basic science is a critical part, right? Then you can discover something, and that's called translation research, from the basic science and move it to the bedside, from bench to bedside, right? Or something in the clinical and do reverse and go back to test it and see if it's really working what you do. Like you could find a material, natural material in the nature and use it, but then you go and test it and animal and lab and do a reverse translational. What really my area of interest is a clinical research, randomized clinical trial, prospective clinical trial. That's where I built my career at. I started from case report, case series, cohort studies, and I was lucky to have run multiple national prospective registry and clinical trial in the United States. Currently, we are part of a trial. You can follow us on LinkedIn and follow us on Twitter called Picasso Trial. We're running in Toledo, Ohio. Picasso Picasso randomized trial is Picasso randomized trial is looking at the mechanical thrombectomy in tandem occlusion versus angioplasty versus stenting. So we're looking at angioplasty versus stenting and mechanical thrombectomy. So I think you should start with case report because it gives you the flavor whether you like to write or not like to write. So it's not an easy thing. People make fun of people who write a case report. Try to sit down and do a case report. It's a lot of work. It's a lot of um, brain exercise, brainstorming to sell a story about a unique case. It's not a simple things to do. Then you move to a case series. If you like, so what I tell my current fellow, he's from Al Majali from Jordan. He actually just took a job in Louisiana, so I'm very proud of him, and I'm trying to mentor him through his career. There is a disease, intracranial stenosis, and we start to do for the brain drug-eluting balloon, drug-eluting balloon. So it's a balloon that laced with medication to prevent restenosis. So not a lot of studies in the United States. So we start to do this off-label, and now you collect that data and become a case series. Then you own that little niche, and that's critical when you plan your when you put your plan of action. Your plan of action should be: I want to focus on niche before anybody realize I'm going to be ahead of everybody. So we're using a coronary balloon that's drug-eluting balloon, and now we're using it to the brain. And now we're going to make a name for ourselves out of that niche. So focus is critical. So you start with a case report, two case, you get ready for the case series, and then you start to own start to own the field. Then you go to a case control studies, right? Case control studies is okay. I have that series, right? So I publish it as a continuous case series, right? But hey, what? I have a historical patient from the brain without a drug-eluting balloon. Now you're doing a control group, but not randomized trial. Very cool, right? Now you publish a 3 paper in the same field. Now people start to know you. Oh, next time we want someone to talk about drug-eluting balloon in the head, we're gonna call Muhammad. Muhammad, come and talk to us about drug-eluting balloon in the head, not in the heart. Now you start to own the field a little bit. So these are something, I don't want to overwhelm you with the methodology. It's just example, how these studies look like, right? Then the cohort studies. The cohort studies is already existed. You already collected data on people in the community, and you look at risk factor, estrogen and stroke. They're already on estrogen. They're already on this and that. Uh, so kind of cohort studies also a quick way to build your career, right? Now, the randomized trial is the hardest because you need to have a name. Because people like right now in the Picasso randomized trial, I have a grant for $3 million. So people doesn't give me $3 million because I was Osama Zaidat from 20 years ago. So you have to have a name. You have to have what do we call like credibility. You have to have a credibility. You have produced, you have made things different. You've done Tesla, you've done visit trial, you've done that. So you can't come like same like what we started by saying you have to be a good clinician before you become a good researcher. The same thing. You're not going to run randomized trial, which is the dream of everyone, to do a randomized trial in New England when you don't have the track record. So you have to build the track record. How do you build a track record? By the study type that I mentioned to you before. So case report, case series, retrospective studies. So before I embarked on my randomized clinical trial, I'm running it from Toledo, Ohio. I'm not Harvard, but believe it or not, I have UPenn participating in my study from Toledo, and I'm in a community hospital. But I have all the famous people sending me patients and randomized in my, like, University of Utah, University of South Carolina, all of them participating and sending me the data and randomizing. So again, to get to that level of randomized trial, you have to walk the walk and talk the talk. So you got to be patient with yourself, but have a plan of action. You got to have a goal. Like, you guys are young in the 20s. Okay, I want to do my first randomized trial. If I want to do clinical research, and that's why I'm here for you guys, for that aspect. I'm not good at basic science. I'm not good at other things, but I can help you with this. And maybe startup company, maybe medical device company, but don't ask me about pharma company. I'm very much versed with the medical device, but not software, for example, or AI or other things. So, but I can forward you to maybe Chris, who did the Viz AI and helps you how he started the Viz AI. Again, after you establish the clinical research evidence, then the component of the evidence, knowledge, judgment, understanding the patient belief and preference to apply it. Application of your judgment is really critical, right? After you establish the clinical research evidence-based medicine component of that evidence-based, right? Your clinical expertise, your training, then the patient, the value, the preferences, what makes a difference. Then you establish the evidence, right? So the best outcome is for people who know everything, clinician, patient value, and then the research all together combined, right? So I think then you appraise the evidence. Some evidence are bad, some evidence is not good, some of them are not applicable to all the patient. Like they always say, not every randomized trial, not every clinical based and research you produce yourself is applicable to every patient. So you have to look at the applicability of the evidence, right? So that's where I think evidence-based medicine, when you practice, to ask the clinical question, you need the clinical training. To really acquire the evidence, you need also the research training, right? Then the judgment on that evidence, the ability. Have you been a reviewer in journal? Have you been critical of other people's work? That's critical for you to appraise your evidence and other people's evidence. Then applying it depends back to the full circle. To apply it, go back to your clinical experience. Just the number, don't take the number. Although I'm a very avid researcher and a clinical researcher, I don't apply my own number to every patient I see for thrombectomy. Sometimes I still use this, excuse me, this approach. Sometimes I use another approach. For example, aspiration and thrombectomy in my field. Aspiration, suction like vacuum, and mechanical thrombectomy with a stent retriever. Sometimes I feel some patient better with a stent retriever. Sometimes I feel patient better with aspiration, regardless of the data and the evidence. So you have to apply it with your medical and clinical knowledge. So back to the clinical knowledge to assist the evidence again. Then you look at guideline. I was very lucky to be part of guideline. We published guideline. I sat in committees for guideline. This is critical for you. What Muhammad told me, he does a systematic review. So people take 2 to 3 clinical trial. Right now, we are trying to pool. And there is more cool things recently, which is called individual patient data meta-analysis, IPDM. But to do an IPDM, you have to be the PI of one of the trial. So right now, for example, the randomized trial that I published most recently, the Tesla trial in New England Journal, in JAMA, that now part of 5 other trial, and each PIs collectively will share the individual data and becomes individual patient meta-analysis, which is Muhammad, that's a different degree than a typical meta-analysis. So IPDM is another thing coming up to this. But back to this, if this is not today, we are trying to help you with building your career. You have to find your cup of tea. You have to find what excites you. You have to excite, like I'm an old man. So this stuff still excites me. Now I'm finding the startup of medical device excite me. So you want something in your career, not be bored of, not be like, okay, I'd rather not do it. And maybe your family is the most thing exciting. Then you want to be a clinician. You want to just see patient. That's totally respectable. Totally respectable. Everybody has to find his own cup of tea. I'm actually, mentoring a student from Jordan right now, and she's so smart. And she said, like, I want to have a family, but I really like teaching. I like education. I have an online platform that I educate with. And I was impressed with this 4 Jordanian physician have an online form to teach medical students. They are very impressive. I just learned about it from her. She's doing an observership with me. She's shadowing me. And she told me that they have platform that they do this. I said, oh my God, you should build on it. You should become an entrepreneur. She said, but Dr. Zaidat, That's not my cup of tea. I want to have a family, kids, grow, blah, blah, blah. All that stuff, that's totally acceptable. You have to find what makes you excited, what wake you up in the night and not be sour. The worst thing for resident to me is to come on call and he's sour that he's on call. That's not the right attitude. That's not the right way to do things. If you just want to go through the pathway, maybe it's not the career. You're going to excel better. You're going to be maybe the next Steve Jobs. You're going to be the next Bill Gates. So don't do things that makes you miserable. Life is too short. Try often, fail often, and find what makes you excited. I really, I cannot really say more than the blessing of God for all the things that have happened to me, because I have not been ever not excited about teaching resident, teaching fellows, publishing a paper. If the publishing a paper in the beginning, like everything in life, in the beginning it was amazing for me to see my name in PDF, to see the proof, to blah blah blah. It will get a little bit older. Then you have to find a different excitement. Take yourself to the next level. Always take yourself to the next level. Persistent and perseverance. Excuse me. Okay, there's one thing about this. One thing about this. No matter where you are, you know what the bullet point, that most important one, the most important one that common for every successful teacher, every successful researcher, every successful entrepreneur, that's something anyone here say like, no, I don't want to work hard, I want to work smart. That's an absolutely killer for your career. You have to work smart and hard. There's nothing comes without working hard. Nothing comes without working hard. I hate that one. I don't want to work hard. I want to work smart. I want to sleep and the money make. But if you want to make money and if you want to look for number, that's great. We all at one level. If you I think between age 40 and 50, most of you guys will have enough income. Then it becomes a number. Then you're trying to look for something to excite you. So I think this is critical. This is like my career path. How did it evolve from residency and from Jordan University, then residency at Case, then vascular neurology at Case, then master when I was a faculty. So you have to equip yourself with a foundation. Then my endovascular at Duke University, then my teaching career. So I had grant from NIH. I have industry sponsored grant. I had probably over my career more than $10 million in a grant that helped me in people and helping people. You have to look for helper. You have to find helper. You have to, when you have the money, you have to immediately look for people who can write paper for you, collect data for you, help others to find job and put them on the path, but it helps your career. Very critical, very critical. Become a journal reviewer. Become a journal reviewer. People looking for reviewers. Reviewer is not thankful job, but for people like you can do it. I hate to do reviews. I don't do reviews anymore. I hate them. It's too much, but it's a phase you have to do. It's a phase you have to do of your life, and I think young people should do reviews. My resident, I try to ask them to do 2 reviews before you graduate, so I assign them some of the journal article to review. So journal club is critical. Writing grant, time management, budget writing, people management, understanding the local regional to become, start with abstract, review paper, book chapters, case report, case series. There's a lot of opportunities you can write anything if you want to do it. You don't even need me. You can send me a review paper that you already thought of, and I can tell you if it's a good idea or bad idea before you finish it. So a lot of things. Then collaborate. You need some other people, because you cannot. And I don't have my 400 papers from nothing, right? Because half of them are collaboration. I give data to others, they give me data. So it's very critical to collaborate. Infrastructure, mentors, coursework, master stat, ethics, IRB, scientific reviews, adequacy of resources, infrastructure. Get involved, volunteer. Every little society is American Academy of Neurology, neurosurgery. They want students. We love the student. I'm doing this on Sunday because we really love the student. We want to see the new generation. Makes us look younger too, when you see those young people. So connect with the sign, with the AN, SVIN, Neurocritical Care Society, SNES, ESMAN. Come and meet people. Don't be shy. Meet people. Connect with people on the social media. Muhammad find me and connected with me on LinkedIn. So volunteer, give data. Work hard. Chase your mentor. That's number one. I'm very, very busy. Muhammad chased me. I told him like I forgot that I have a meeting. I just came from Utah yesterday. I was in LA the before. I was in San Francisco before. So I was totally booked. So I went up at 4 in the morning to give you this talk. So, and I arrived at home at midnight. So, we are busy. We're not ignoring you. We're not rude to you. You have to chase the mentor. Don't give up. They are busy. They are not trying to ignore you. They are not trying to mean to you. Find them in the hallway. Chase them. Be annoying. If you're not annoying, you're not going to make your career. Okay, this is another advice. You got to be annoying. How?
Yeah, no.
Yes, you got to be annoying. You got to be annoying. If the you want to make the mentor run away from you in the hallway, not the vice versa. If I'm chasing someone who wants to write a paper, probably a bad idea. Find your area of interest, learn some stat. I like jump. Other people like SPSS. So my favorite one is jump. That's what I learned on. It's window based. It's not that fancy. Get the data and then develop your own niche, like what we talked about. Again, what is any project is a good starting project. Okay, any project is a good starting project because it's a project is what is it? It's like when you want to take your first car, right? Take your first car. You want to take a Skoda, the Russian old car, right? And wreck it, right? I don't give my kids a good car, the first car. The same thing with research. Take a case report, take any project, learn from it for the fancy project. Don't be picky. Don't be picky. This is neurology example, research. This is this is how I started. I published on my intracranial stenosis. I published case report. I published, the NIH grant series. Then we published the visit trial in the JAMA. So it didn't come overnight. When I got to the JAMA, it didn't come. When I did the intracranial stenosis career at that time, it didn't come overnight. It came from case report, case series, and then the randomized trial. So there is a stepwise progression, stepwise progression. Follow the same path. Again, there's a lot of opportunities. It's a long journey, but it pays to discover. Don't give up. Be persistent. The good ideas are abundant. Hard work and persistence is scarce. Everybody have ideas, but very few people have the hard work and the persistence to see it to the finish line. The end result is fulfilling, gratifying, and satisfying. I can tell you that. Don't worry about the end result. Just enjoy the journey. Don't worry about the end. It will be there. It will be there. If you focus on the end result, it may not come. But if you just focus on the journey, the end result will come. You know, Start your clinical database from the beginning of your clinical career. Have a goal. If you want to have that career, have a goal. If you want to become administrator, go to MBA, have a goal. you know if you want to be intellectual challenge and more inquisitive, then do clinical research, or do at least some sort of research, basic science, anything, what you want to do, irrespective of your neurology or neurosurgery or neuroscience. Of course, I'm biased to neuroscience. I think it's the best field in the world. It gave me a lot, and I think it's the best field in it. Right now in my program, we started two Alzheimer infusion medication, which is amazing, which is dementia. People thought is irreversible, and now we have two Alzheimer infusion centers in Toledo, Ohio. Leadership career. If you don't like research, that's fine. I wanted to become an MBA. I wanted to become the head of the hospital. I want to be the CEO of the healthcare system. One of our Jordan University, Muhammad, his name is Abdurrahim Asfour. He's from Abdurrahim Asfour from our class. He's now MBA, and he's now a hospital administrator. Invite him about hospital administration career. We want more of medical students open their eye to that path. Abdurrahim is my class. I think he has, look him on LinkedIn. He's the chief medical officer, maybe in Arizona. So Abdurrahim Asfour, keep that guy in mind. Get involved in hospital committee. Learn about healthcare administration. Get an MBA, business courses online from Harvard, from whatever, Yale University. Another good guy to bring here is Amjad Hamad from my class. I'm very lucky. Our class of 1993 have achieved a lot. Watch it on Doximity. Watch us on LinkedIn. Amjad Hamad is phenomenal. He's an ophthalmologist from United States, so he's an ophthalmology. Business courses online. Emotional intelligence is really critical. You gotta smile often as Jordanian. I agree with that. You gotta smile often during the interviews. I interview a lot of people. We need to present ourselves. We need to look interesting. We need to look like fascinating humans. We need to bring to the interviews. And one day I can tell you, I interview 90 people every year for the 5 spot. So if I interviewed in my career 1,000 people, so I can give you a lot of advice how to present yourself in the interview. Emotional intelligence, finance. It is the future of MD admin. I really like to push people to MD admin in my residence. Teacher career, education, become the best educator you can be. It's really critical. You can even write a textbook about education. So it's really fulfilling career to see. I'm sure your teacher and my teacher love to see us where we are today. So if you want to become a teacher, that's fine. You can pick and choose. Industry is my most recent adventure. And I'm going to finish with this one because I really love Galaxy Therapeutic. I'm really fascinated by a startup. I run a company on the side with 20 employees. There's 9 engineers, technician. As I said, hopefully one day we will sell the company, and I can tell you more about medical device startup. I have no experience with pharma. I have no experience with software. I have no experience with AI companies. But my friend is starting an AI company to discover a nodule in the lung using an AI algorithm. I'm not familiar with AI, but I'm what we call I'm a hardware guy. So I invented this device. Look it up on LinkedIn, and it's called Seal device for brain aneurysm. I think it's a huge opportunity. There's a lot of graduate in Jordan. They should look into other career pathway in pharma industry and starting companies. So again, my final thought for you is work hard, be persistent, don't give up, don't let people let you down. Believe in yourself, believe in yourself, believe in yourself. If I can make it, you can. It always seems impossible until it's done. Success is not final, failure is not fatal. It is the courage to continue that counts. Fall 7 times and stand up 8 times. So really those quotation, you're gonna have, you are young, you're gonna experience all of them. Thank you guys. Thank you for the invitation. Thank you, thank you. Any question? I know I took
If
about 4 minutes above hour.
no, if we have a question, please raise your hand and I will choose. Okay. Okay, Abdullah.
Hey,
Assalamu
hey guys.
alaikum. Which Abdullah? I'm sorry.
خطأت.
Yeah, it's me. So thank you, Doctor, for giving us this lecture. Actually, I can really relate to everything you said, starting from being a first generation doctor up to even I'll say that my last research project was applied to your journal, the SVIN. This is absolute luck. So my question is, I'm applying for residency this year. So what do you look at for a resident, or can you tell us more about your program?
Yeah, I mean, for me, when I start September 15 or the end of September, looking, I'm very busy, so I screen the application myself, and I look at my 550 applicant in Iraq, and I rank them. I rank them. I'll be honest with you. I rank them based on the score because I don't have that much. I know you could discover a beautiful diamond in the crowd, but it's beyond my capability as a human being, running the best program, seeing patients, doing procedure, running my startup company to really dig deep into people with below average grades. So your grades makes you in my pool. So now I'm about 150 top from the 550. Then within the 550, I start to look at really interested in neurology. Can they be the next generation of neurologists? In my program, I'm neurologist, not neurosurgery. Then I can start to read their personal statement and between the line how much genuinely interested. So that's the screening that after the grade. And then we have another, I'll be honest with you guys, we have other criteria. In my program, they want people to be step 1, 2, and 3 because we give H1B visa and they don't want to deal with J1 visa. So they like us to interview people who are committed to do H1B before the match day, before March 15. So I usually, if I like someone, I will tell them, look, can you make sure you do the step 3 and get the result before March 15. So that's another criteria. Then we go to other criteria, which is the gap from medical school's graduation. Our program, overall, our hospital doesn't allow us to get people who has been out of medical school more than 5 years. So 5 years become this. The attempt is a nightmare. It's really hard, even with all the connection in the world. Abdurrahim Aspoor, Amjad calling me, can you help? Lots of my friends call me to help to get an interview. It's hard for me to overcome the failed attempt. It's not an end of the. You should keep hope. You should keep trying. We can have a different strategy for people who failed attempt. But if you fail attempt, it's really hard for many programs. It's not impossible, but then maybe you need to do a research year. Maybe you need to be able to love you, people, to commit to you, to show that, one failure is not the end of life. So you have to have a different strategy if you are in that group of people that have a very, very low score, or very or a failed attempt, God forbid. And then I look at then you pass. And I tell my kids, I have three boys your age. My oldest is doing orthopedic at Yale University, so born and raised here. So what I told them, no matter where you're from before Yale, the foreign graduate can win over you because it's persona. That day you have 5 minutes to show off your persona. So you guys have to work on your accent quite a bit. Work on your accent. Take online courses. People relate to people who uh, who can speak their expression, can joke with their expression, can use their motto, and the people relate to this. So my advice: take some courses about, especially with AI, to enhance your accent, to enhance your expression, to enhance your ability to be fluid in the interview from language standpoint. Then the persona becomes really critical. Uh, you don't want to look like, you want to have a good night of sleep. You want to be at best performance, because now we forgot about your personal statement. Now we forgot about your medical school grade. Now we forgot about everything. Now we are ranking you based on your first impression. So I'll tell you an example. One of the guy told me, and he said, I read in his personal statement, he was, trying to support his family in Jordan. He will go and sell goods like, socks and underwear and bra, all in the street of Amman. You know, believe it or not, that story is much more important about his research story. So that personalized him, right? So I texted him. I said, "Look, I'm impressed with this. When we interview you, please bring how you struggle, how you were working in the medical school and doing this, and how the police comes and you have to put everything and run to the alleys in Jordan." So these things, like hobbies. I like people to say, like, I do an art. Then maybe show us the art. So hobbies that people relate to, or you like music, what do you like, or if you're applying in USA, maybe movies is big things. What's your favorite movie? Blah blah blah. So personalize yourself, smile, personable, friendly, and definitely not emotional. Definitely avoid having any sense of, could be a problem with interpersonal. People always look for the psycho, more or less, in the interviews. They look like they want friendly, and they want to avoid somebody with a friction, somebody with. But we can talk about it. I mean, we can definitely talk more, but it's a good question. I don't want to take a lot of people time, but yeah, be friendly. After you finish your academic, be friendly that day, be personable, bring something unique about you.
Okay, Abdullah Sabah.
Hi, Dr. Osama. Thanks for your time, and we are happy to have you today. I
Thank you.
have quick three questions. The first one is, as a med student planning for residency in the US, when it comes to research, what do you think is more a programmer value more, having a higher number of publications or higher quality impact?
What's more critical for the programs, having more publication or what?
Or having a higher quality impactful project?
I didn't get, Abdullah. I didn't get the second half.
I mean, when it comes to programs value more, having a higher number of publications or focusing on a fewer but a higher quality impactful
Okay,
projects?
yeah, okay, got it. And I think it depends on the specialty, right? If you want neurosurgery, if you want
Cardiology,
yeah,
and
yeah,
like
can
cardiology, for example.
Yeah, I totally see your point. I think it depends on the specialty. Neurosurgery, quantity and quality is important, very important. Neurology is not that critical to have that many. That many. I think. I think it's unfortunate that the door is closed on observership. I think one thing that's really critical for picking you as a fellow is, maybe if you know that you're going to impress people and you have the right persona. Sometimes it's a risk. I tell people, including my kids, it's a risk. It's two-sword edge, right? If you go there and people don't mesh with you, you could have the best score publications. Oh, and like it doesn't mesh our culture. So, but in general, 1 week observership, if you can get into few programs, and that you're gonna nail it down, regardless of your grade, you will win that program. So exposure to you is critical, in my opinion. Now, on the paper, if you're looking for very competitive specialties in the United States, like ophthalmology, neurosurgery, orthopedic, and you are a foreign medical graduate, you need very heavy CV. Very heavy CV. Numbers is critical more than just quality, because they know you're not going to publish in New England or Nature or Science when you are a student, but they want to see that you're really hardworking and you published a lot. So if your aspiration, to become a neurosurgeon in United States, you may need a lot of publication. And we can connect you with a lot of Jordanian who managed to break the wall and get into neurosurgery residency in the United States. We can connect you guys.
Okay.
Okay.
The second question is, I'm currently working on a new ECG software. What do you think? How can you help me, or what's your advice on that? I'm gonna say it again.
Yeah.
Dr. Osama, I'm developing a new ECG software by
Okay.
AI, a new
Okay.
AI tool for reading ECG, a hybrid tool. So, what's your advice to me, or how can you help me?
Yeah, I mean, I think the EKG, new AI EKG tool is very
E-
cool.
ECG, not EKG.
E
ECG.
EEG, brain.
ECG now is for the
Yeah,
heart.
it's the same.
Oh, okay.
ECG with the C.
I think, like I mentioned earlier, like my experience with AI limited, but I would think that you wanna, try to. I'm not sure, honestly. Like you want to try to explore an AI expert, but I can like connect you with my friend Dr. Hamad Nassour, who started an AI company to detect lung nodule. Um, so I think he hired a Jordanian AI company, believe it or not, which is nice because he raised the money from us in the United States and he created job opportunities in Jordan, which is really nice. So I know the guy, his name is Jadallah. He's an AI company in Jordan. Jadallah uh, is very savvy with AI. We can connect you offline with that guy. I mean, again, my startup company is an actual brain implant, and that's where my strength is, and neurovascular devices that are not AI or software driven.
Okay.
Another,
Thank,
question.
thank you, Abdullah.
Dr.
Uh, Hamad.
Hello, Dr. Osama. First of all, I would like to thank you for the insightful talk. I want to ask about medical students that are applying right now for their electives. Do you think it's better for them to apply to elective programs, or if they have a connection, like big hospitals, like Harvard associated hospitals, or would it be better to go to smaller hospitals for the match if they're planning to apply to the match?
Yeah, I think, like I said, this is an excellent question. Excellent question. I absolutely agree with that. That's what I said. I think that gives you a big push into any program. Like people who come to me almost always gets an interview with me because they put the time and effort with observers in a community program. So the question is twofold. What are those opportunities? I think Jaba, Jordanian American physician, working on trying to create a list of observership opportunities. And as I mentioned to Abdullah, it's locking down, and it's unfortunate it's locking down. I think I'm trying to push, being an American Jordanian, the American system to make the observership, if anything, a systematic way and more opportunities, because now you have more than 5 minutes to have an interaction with the candidate, then it will give you a very, very huge opportunity to pick the right one and for them to pick the right approach. So that's one thing. So Jabba, to answer your first follow-up question, for me to introduce you, United States is really hard. The same thing I will be, what people like does, like, hey, Abdullah Fayyad is a GI from Aurora, from Milwaukee. He's a friend of mine and he's my classmate. So he said, like, you know, Osama, can you help this candidate? He's coming to you. I say, can you manage to? So it's a word of mouth between each other. But at an institutional level, it's very hard for me to say to Harvard program director in neurology, even if he knows me and knows my name and knows my notoriety and visibility in the stroke field. It's very hard for them at an institutional level to know unless I know them at a friendly level. So I can help with the people I know. Like I can say, hey, Amjad, in your private ophthalmology group, can you take a Jordanian student? I can ask Amjad. I can ask Abdullah Fayyad in your GI clinic. Can you have some Jordanian? So at an individual practice, we can help you guys each other. But JABA may have a better systematic way to help elective. The third part of the question is it better to do it in a community? It depends on your aspiration. You know, if you want to become to have a big name behind you and you want to dream big, why not go to Harvard elective or Case Western elective or Duke University elective? So it doesn't hurt. You know, it depends what you want. Or you want to become a clinician and you don't care, you want to get the residency and get the American board and move on. You know, community probably better for your chances. That's
I
all.
don't want to. I don't want to take up too much of the time. We have the opportunity to do possibly an elective at one of those Harvard-linked hospitals because we've worked with a doctor there for quite a while right now. But our dilemma is if we go there, will they push for us in the match? So would it
Yeah.
be a waste of time or not?
Yeah, I mean, there's only one program. There's two people that run any program, right? In United States, we call them program director, which is myself, and an associate program director, right? Associate. Big program may have two associate to help the program director. So those are the three physicians that have a strong decision making. Because even if you have a committee at the night of the ranking, the program director have the final say in putting the rank list into the rank. So I think it's always good to be in a place where you find the program director and hang around with them so they can see you. So that's my only advice. Because sometimes it's a catch-22. There's a political dynamic in any department. You may be doing an elective with a guy that the program director hate the most. So instead of helping you, it takes you to a different direction. It's more common in academic. The department are more friendly in community than in academic. There's more competition in academic between faculty than community. So community, no matter who you hang around with, he may have a leverage over the program director. While in academic, the two guys may not be even talking to each other.
Okay.
So I mean, that's something to keep in mind. But you know, you got to do what you got to do. You don't need to worry about those. You know, you got to do it because if it didn't help you in the same program, it will. I mean, oh look, this guy did a rotation and observership at Harvard, so I'm going to take you to give you an interview for. So you're going to get the benefit of it, one way or another.
Thank
Okay.
you so much.
You're welcome.
Okay. Omar.
Hello, Dr. Zaidat. Thank you for your time and effort. So my name is Omar. I'm applying for neurology this first cycle. Actually, Dr. Muhammad Mujal is mentoring me, so I'll be a little bit annoying for him taking your advice. So one small question is,
Muhammad, I've been telling him he has to be the next leader and the next CMO. I feel like he's going to get that personality.
so
But he
my
knows it.
question
He
is,
said, if I go back to Jordan, I want to become the minister of health. He knows it. He knows he has skills.
yeah, so my question, you did not mention the era signaling when you talked about the recruitment of residents. So, how much weight does your program put on era signaling? And Montasem actually asked a good question on the chat. He asked about the weight your program puts on US clinical experience.
So I think the signaling, I think the signaling is really becoming very important, which is, I don't know if that's good or bad. I did not believe in it. I felt it could be tough. This is the first year I'm doing signaling. This is the first year in my program. But I think it's becoming a standard. It's becoming really a standard, the signaling. And you guys have to pay attention to signaling. Some people don't interview people who doesn't signal them, doesn't rank them. It's just crazy what's going on with the signaling. So I don't know where this evolved. I was not a believer in signaling in the beginning in my program, but this is the first year I'm going to try it and see how it pan out. So I don't have a lot of first-hand experience on signaling.
Yeah, so I mean, if you have a lot of applicant number, you can filter it out by signaling.
Yeah.
That's, yeah, some ideas. And regarding the US clinical experience,
Yeah, what I mean, like, would I just like interview the people who signal the program? Would I interview people? I already been okay. Another factor I think Abdullah asked me early on. When I pick people for interview, I already look at people who are within the Midwest area up to the east. I don't like to bring people from California who are probably just like as a backup. So Arizona, Las Vegas, I don't interview them, period. So there is some sort of regional preference, and that's another thing. If you live in the United States, but coming from overseas, you can apply across the whole nation, no big deal. But if you are a graduate of USA or live in USA, then I very much focus on the regional advantage. That's a big advantage for me. If you're a US graduate, but it's not applicable to the national ones. So I think any other question? I think I have a question in the chat.
thank you so much, Dr.
You're welcome, Habib Omar. Any question? I think Ayla has a question in the chat. What was it?
Yeah. Can I read it?
Yes, you can read it.
Okay.
And
She said, does the medical school GPA matter if I struggled a bit in basic year and did better in clinical? And if it's not that great, can I compensate with a good USMLE step 2?
yes, I think you can. Absolutely. You can compensate. You have to try to compensate in many other aspects of your application. And it makes a difference. It does make a difference, 100%.
No.
Yeah, good strategy. Already, Muhammad, we can definitely book more time, but
Yeah,
I have a meeting in the next 5 minutes.
of course, yeah. So
But
thank you very much for your time, Doctor. It
no,
was
my pleasure. My pleasure.
it
Wallahi,
was an
wallahi,
honor to have you, actually.
wallah, my pleasure. And the least I can do for you guys, the least I can do.
I
Habibi.
like it.
Yalla, bye-bye.
Thank you.